Assalamu alaikum. We are live now. So our today's topic of discussion is polycystic ovarian syndrome. And for polycystic ovarian syndrome, first you have to understand that what is the disorder that is causing this dysfunction. It is mainly ovarian dysfunction, along with cardinal features of hyperandrogenism and polycystic ovarian morphology is mainly concerned. Its clinical manifestation include menstrual irregularities, signs of androgen excess. Androgen excess, whenever there is androgen excess, it has more features of hirsutism, increased hair growth on face and body, and central obesity. And when we send the labs, there are elevated LH levels and insulin resistance are the most common features. PCOS is associated with increased risk of type 2 diabetes also. And some cardiovascular events are also associated with its prevalence. So it should be around 5 to 10% of the women. It is more common in 5 to 10% of the women of reproductive age, and the prevalence of PCOS is much higher when a scan is done, ultrasound is done, and in ultrasound it's around 25%. I just want to show the picture. You can see here in ultrasound, this is the picture in which ovary is shown, and in ultrasound you can see there are multiple antral follicles are also present. This is an ultrasound picture in which multiple antral follicles are also present. This is an ultrasonic presentation of PCOS. Now, our main concern is what is the etiology? What is causing PCOS? It is not clear that what caused PCOS. It seems like it is idiopathic cause of it, but it is a systematic disorder. In this systematic disorder, the clinical features are mostly oligomenorrhea or amenorrhea. Patient coming to us gave a history of having no menstrual cycles for 1 month, 2 months, even sometimes they are not bleeding for more than 3 months. So, their clinical features, they are having hirsutism and obesity in 40% of the cases, and even if they conceive, they have recurrent miscarriages 50 to 60%. And some women you have seen there is a black line around their neck, that is called as acanthus nigrans. These are the increased velvety skin pigmentations, and it can also be present on the axilla and on other flexures, and sometimes PCO patients can be asymptomatic. Now, how we will diagnose them? We will diagnose them by coming when they are coming with us with the main complaint of oligomenorrhea or amenorrhea, and clinically hyperandrogenism symptoms are present. I already told you hirsutism and heaviness of the voice, hoarseness of the voice. The ultrasound criteria for PCOS is, I already show you the picture of an ultrasound that subcapsular follicular cysts more less than 10 mm in diameter are present in the ovarian stroma. So while these findings support diagnosis of the PCO, there are not much diagnosed by themselves. Sufficient amount to diagnose is to how we have to manage these patients now. Management includes we give them oral contraceptive pills for the regularization of the menstruation, and cyclical oral progesterone is given, and just to regulate their menstruation. Metformin is given to decrease their insulin resistant hyperinsulinemia, and to decrease the risk of cardiovascular risk factors. It is less effective if their clomiphene citrate is used for ovulation induction. It does not improve the pregnancy outcome. So clomiphene can be used to induce ovulation in case if we want to have a improved outcome of the pregnancy, to induce ovulation. And lifestyle modification is the main important thing. Lifestyle modification includes either dietary modification, exercise, regular workout, or to decrease the risk of diabetes and cardiovascular diseases. And the weight reduction is the main key to reduce the symptoms of PCOS. So for hirsutism, we can use Topical some creams to decrease the hair growth like e-fluorinethine cream in it is also available in the by name of Vanica. And we can give contraceptive pills, anti-androgenic pill like and iron 35, and metformin to decrease the insulin resistance and availability of insulin and decrease the symptoms of hyperandrogenism and increase the anovulation cycles with PCOS. GnRH analogs are rarely used, and surgical treatments for the hair removal like laser and electrolysis. And if you like my live session, kindly do subscribe my channel for further videos and further informations. Thank you so much.
यारी बजवे